I get calls all the time from people who have had a poor result from medical treatment. Somebody's been hurt or killed as a result of a medical treatment, and they wonder whether they have a medical malpractice claim. In Pennsylvania, in order to have a valid medical malpractice case, you need to be able to prove that the doctor violated the standard of care. That is, that the doctor did something that a reasonably prudent doctor following proper procedures would not have done, or failed to do something that a doctor using reasonable, prudent, proper medical procedures would have done. What does that mean? I'll give you a few examples. In a surgery case, let's say during a surgery, a medical instrument, a surgical instrument gets left inside somebody's body. That's a pretty clear-cut case of malpractice because the standard of care requires doctors and nurses and hospital personnel to make sure that the wound is free from any foreign objects, including surgical tools, before the patient is closed up. So that's a clear case of likely malpractice. Another case is, for example, an emergency room failing to do proper diagnostic testing or examination in order to rule out that someone has had a stroke. If somebody has clear-cut signs of a stroke and yet does not get properly diagnosed and then gets released from the hospital and then suffers a very serious injury as a result of the stroke, that's another case of potential malpractice. On the other hand, there are other things, bad results that happen from medical treatment that are not malpractice. Infections are usually a recognized risk of any type of medical procedure, and the fact that somebody gets an infection in the hospital doesn't necessarily mean there was malpractice. Instead, there likely wasn't. It's just likely that that's a complication from the procedure and not malpractice. Now, if that infection is not timely diagnosed and properly treated, that's another situation that might be malpractice. So each case has to be looked at based upon its facts to determine whether it's just a complication that occurred or an unlucky result from medical treatment, or whether somebody's been injured as the result of malpractice.